Okay, we are just getting the PowerPoint up. Thank you, Jesse. Welcome. This is our research review today on endometriosis and pain management. My name is Christina. I'm a physical therapist here at Women's Advantage, and I am joined by.
I am Jessie Lopez, a physical therapist assistant here with Women's Advantage Men's Optimal Health.
All right, so we are excited to share a little bit of the research on endometriosis and pain management today. So we're going to flip to the next slide.
So, first off, what is endometriosis? And it can be described as a chronic condition where the endometrial tissue that usually lines inside the uterus can be found in other places in the pelvis, such as the abdominal cavity, the organ tissue, the ovaries, fallopian tubes, bladder, and bowel areas. And typically, you'll see a lot of pain associated with this and infertility. It is estrogen dependent and considered a chronic inflammatory condition. And pain can be ranged between moderate to severe pain. And we'll see issues with gastrointestinal issues as well as bladder symptoms. Um, People will often report heavy bleeding, painful menstrual cycles, painful intercourse, and painful urination. So we will talk a little bit more about what the research says here. And this study here was in 2017. And what we know is that statistically, pain intensity and the degree of thoracic kyphosis, which is the round curvature of your mid back, does it get impacted in a positive way with as little as 8 weeks of low impact exercise regimen. And we'll talk about that in a second. Our goal with physical therapy is simply to help relax all the muscles so it helps decrease the pain, your pain cycle, and through movement, manual therapy, education, and helping to give you a little more resources. So, what did the study do? It involved 20 patients. Of these, they were aged between 26 and 32 years old. These the exercise was for 3 times a week with moderate intensity, perceived level of exertion, for up to 30 to 60 minutes a day. And so what we know is that these people responded well with low impact exercise, which involved stretching, different types of breathing. So breathing through the belly, getting a little bit more excursion through the abdomen, as well as lateral coastal breathing, getting a little bit more mobility through the ribs. And and then afterwards, these people walked on a treadmill for about 20 minutes. So we know that there was a positive impact within, and afterwards there was subjectively decreased pain reported after those 8 weeks. And we will
As
go
well
in.
as improvements in posture.
That's right.
Okay, so thank you, Jesse, for sharing more about that article. So, this next article relating chronic pelvic pain and endometriosis to signs of sensitization and myofascial pain and dysfunction. So, this article is a lit review that explores the different types of effects that endometriosis can have on our body's pain generators, specifically myofascial trigger points. And so myofascial trigger points are points in our body within muscles, as well as the overlay on top of muscles, which is fascia. Both of those combined can produce trigger points as a response to the presence of endometriosis. And so what this article mentioned, something super interesting, is that where uh, between 71 and 87% of women with chronic pelvic pain have laparoscopically proven endometriosis lesions, but lesion location correlates poorly with the locations that patients identify as their most intense areas of pain. So, In other words, chronic pelvic pain is something that can be accompanied by endometriosis. And in terms of where the endometriosis lies within the body, sometimes that doesn't always necessarily correlate to where their pain necessarily is. And so I'm going to explain why. And this article goes in a little bit more as to why that happens from a nervous system standpoint. And so, with endometriosis lying in and around the abdominal pelvic cavity, what can happen is the endometrial growth can signal neighboring tissues. Specifically, this article talks about muscles and fascia and nerves. And so, with signaling the neighboring tissues, what started as an endometrial growth in one area can start to tell the neighbors that there's, or can start to signal pain to the neighbors and the neighboring tissues, resulting in pain not only in that area, but also in the surrounding areas too. And so, overall, this article discusses that for treatments with endometriosis, focusing on hormonal therapies as well as surgery, both to target the endometrial lesions and the growth, that might not be enough to take care of the pain that follows endometriosis. And so, coupled with the hormonal therapies and surgery, myofascial release and physical therapy can be really helpful in addressing the lingering pain that someone might have after either getting the endometriosis removed or using hormonal therapy such as birth control to help with the growth rate and management of endometriosis. And so sometimes it can happen where an individual might get a surgery for endometriosis, but then start to see pain following or similar pain to what they had prior to surgery, even though the endometriosis has been taken out. So, what can happen is within that sensation, the neighboring tissues from the endometrial growth, those tissues almost are retrained to think that the endo is still lying within that abdominal pelvic cavity, and therefore those tissues are still in that guarding and protective mode as a result of the endometriosis signaling those neighboring tissues. And so that's where physical therapy and myofascial release comes into play before and after surgery, where we want to make sure that we are getting those tissues to normalize and neutralize and move freely so that we can have less pain pre and post surgery. But overall, if surgery is not part of your plan for endometriosis management, we want to make sure that those tissues are in a better place for being able to work with the endometriosis, as opposed to that guarding and protecting mode that can lead into the persistent pain that you might be experiencing with endometriosis. So overall, the article states that myofascial trigger points can appear as a result of endometriosis, which can contribute to pain and spasm. But as physical therapists, we are trained in being able to identify those myofascial trigger points and work with the body to be able to create more lengthening and movement throughout the tissues. And primarily with endometriosis, we're looking at areas like the abdominal wall as well as the pelvic floor. So what we do here is mapping of those two as well as other affected tissues to be able to see what types of pain as well as different areas of the body are manifesting in those myofascial trigger points that are contributing to the pain generators with the endometriosis as well as the persistent pain that one might be feeling. And so overall, this study has a lot of emphasis on not only treating the endometriosis lesions itself via surgical and hormonal, but also taking care of the myofascial trigger points and spasm that can occur as a result of endometriosis. And that's where physical therapy can come into play. Anything else you want to add to that, Jesse?
Yeah, so our main goal is just optimizing all of your systems, your digestive system, your inflammatory load. We want to make sure that your nervous system is functioning and taking the least amount of load, and guiding you the best way we can through your healing journey. And so we have some references here from the articles we did choose today. And we do have some Christina will be interviewing a physician on Monday, the 8th, and she will be with Dr. Iris Orbick. So stay tuned for that and make sure you listen in on it.
Absolutely. And if anyone has any questions, we'll be having a Facebook Live for questions at the end of the month, as well as you can post any questions down below at the comments and we will get back to you. So thank you so much for listening. We are so happy to have you on, and we look forward to the next time we go on live. Take care.
Thank you.
I think it's still recording.
I know. Okay.